malfunctioning.
The nerve system is made up of the brain, the spinal cord, which travels down the spine, and the nerves that come out from it.
The brain's job in the body is to maintain balance or homeostasis in all of the organ systems, in all of the different tissues. And it's only when the communication from the brain to those systems isn't working that we see these imbalances occurring.
We know from research that all it takes is the weight of a dime of pressure on a nerve to cause that nerve to lose its function by up to 60%.
When that atlas bone is out, it's pinching on possibly the brainstem, the spinal cord, as well as the spinal nerves, which is affecting nerve function all the way down.
When a patient comes into the Pierce Clinic, we do a really detailed evaluation to see if there's any nerve interference between the brain and the body.
But the majority of people we find are out of alignment by the time they make it here.
The advanced orthogonal procedure allows us to accurately assess that misalignment and to correct it using a percussive sound wave.
And the patient really doesn't even feel the particular adjustment when it's made. And our goal is to not only get them in a corrected alignment, but to get them to sustain that corrected alignment. Because when you hold the corrections, the body keeps on healing.
So we influence the joints between the skull, the atlas, the cervical spine, get everything towards center so that it's taking pressure off of the nerves.
That sound wave correction is both gentle for the patient because we don't have to twist, crack, or pop the spine, and it's also very accurate and precise, so we're able to get a long-lasting correction.
We set the instrument at very precise vectors. We bring the instrument down. The instrument itself doesn't poke or prod. It will rest right on the skin, possibly slightly above. All you hear is a click, and that click sends a percussive sound wave down, which will contact the bone and shift it back into place.
The whole adjustment takes about 5 minutes, but it's extremely gentle. There's no cracking, there's no popping. We're gonna get them on their side, and we're gonna position their neck and their shoulders into that orthogonal position so things are very square to begin with.
After the correction, the sound wave allows the bones to move back into place. That takes the pressure off the nerves first and foremost, allows the swelling and inflammation around those nerve roots to start dissipating.
And what's happening is once that bone is in place, these nerve fibers starts to wake up and fire. So some patients will feel soreness in different parts of their body, and that's normal.
But that's a good sore. That's like going to the gym sore. You're getting stronger.
If we find that their atlas is out of alignment where it's pinching on the nerves and that's what's creating their symptom, we move forward with the x-rays.
After we've taken the x-rays and we've measured the x-rays, comes time for the adjustment.
And we'll review the x-rays with them, sit down with them, go over the x-rays, show them exactly where the misalignment is, how it's affecting their body, and also explain to them how we plan to correct it.
Pierce Clinic's trying to achieve the optimal alignment of their head and their neck in alignment to gravity. It tends to give us a better neurologic flow to our bodies, which encourages healing.
Improving your health not only gets the relief patients want from their symptoms, but much more importantly, we get the body functioning better and the quality of life starts returning.
We find that patients who hold their adjustments long-term tend to have less health issues throughout life.
It is not only the physical conditions, but also the quality of life and the loss of zeal for life.
We weren't given a body to break down. We were given a body that's actually made to heal itself.
Our greatest concern is to maximize the recovery of the patient and get them into a good state of health that they can sustain for the rest of their life.